happy to be your master of ceremonies. There are two words that people like at events like this. One starts with F, the other starts with W. It's free Wi-Fi. And so just look for Alisa Hotel and jump on and use the Wi-Fi. I know you're all very busy, and so probably you're still in the office while you're here, but let's keep the phones on silent. Let's use the Wi-Fi. It's generously given to us by Alisa, and we can start our event immediately with an opening prayer. Let's welcome from the Ghana Statistical Service, Reverend Timothy Afu.
Good morning.
Good morning.
I think the energy is now strong. Please, can we be on our feet? And let's be in a prayer mode. Unto him who is able to do exceedingly abundantly, above whatever we ask or imagine, according to the power that works in us. I want to thank you for today in the name of Jesus. I want to thank you for granting us an opportunity to be alive. And we pray that today, as we celebrate and disseminate this report, we ask that your grace, your power, your joy will be with us in the name of Jesus. The Bible says in Psalm 68 and verse 11, the Lord gave the word, and great are the company that publish it. We believe that after today's presentation, it is not just going to sit in our cupboards or it's not going to sit on our website, but we are going to publish it, and at the end of the day, the purpose of this assignment will be met. We thank God for the presenters, and we thank God for participants. We pray that at the end of the day, our heart and our mind will be filled with joy. This we ask in Jesus' name. Amen.
Many thanks for the short and powerful prayer, Reverend Timothy Afu. Now for the official welcome, I would like to invite to speak Director for Survey Organization and Censuses at the Ghana Statistical Service. Let's welcome Abena Asamwabia Osayakoto.
Thank you very much, Kafui. First, you are one of those who have mentioned my name properly. There's Samoabia. Thank you very much. I'm welcoming you on behalf of my Deputy Government Statistician, Dr. Faustina Frimpong Ingwa. Director General, Ghana Health Service, the Government Statistician, representative from the WHO, representative from USAID, our development partners, directors of Ministry of Health, directors of Ghana Health Service, directors of other ministries, departments, and agencies, directors and staff of the Ghana Statistical Service, esteemed members of the media, distinguished invited guests, ladies and gentlemen, good morning. On behalf of the Governing Board and management of Ghana Statistical Service, I'm honored to warmly welcome you to all this momentous occasion. The National Dissemination and Launch of the 2022 Ghana Demographic and Health Survey Report. As we are all aware, the service stands as the entrusted institution mandated to generate official statistics and charged with the coordination of the national statistical system, and is committed to upholding the highest standards to ensure the quality of statistics produced in Ghana. Today marks another important milestone in the ongoing endeavor to provide accurate and reliable official statistics for our nation. The Demographic and Health Survey is a nationally representative household survey that provides data for a wide range of monitoring and impact evaluation indicators in the areas of population, health, and nutrition. The 2022 GDHS aims to provide estimates of demographic and health indicators comparable to results from the 6 previous rounds conducted in 1988, 1993, 1998, 2003, 2008, and 2014. at both national and regional levels. DHS has proven to be a vital source of information for the Ministry of Health, enabling the measurement of outcomes and impacts of health programs. It is extensively used to formulate annual and sectorial plans. Today, the 2022 GDHS is generating data on 44 SDG indicators across various crucial areas, including vaccination coverage, antenatal care visits, health facility delivery, postnatal care, child feeding practices, women dietary diversity, breastfeeding, child growth monitoring, household food security, maternal health and fertility, childhood mortality, domestic violence, treatment seeking, contraceptive use, unwanted pregnancies, hand washing facilities, basic and limited water service, basic and limited sanitation service, sleeping space, sleeping rooms in the households, type of employment, access to newspapers, television and radio in terms of media access, access to the internet and mobile phones, obesity, access to the internet and mobile phones, and ownership of assets. This comprehensive set of indicators will provide valuable insights into the health and well-being of the population, aiding in the assessment of progress toward SDG targets. This release is occurring at a time of considerable change and excitement for the global data community, as efforts are increasingly being made to provide timelier, more relevant, and quality official statistics for more effective evidence-based planning and decision-making for socioeconomic development. As part of the service's ongoing efforts to provide and make accessible quality official statistics for effective policy formulation and decision-making, the GSS released 17 census and survey reports last year. Also released were reports based on administrative and other data sources. There were 4 reports, digital products to provide direct access to customized tables, maps, and charts. We have 3 such online products, including the Stats Bank and then the Statistical Masterclass that we've also availed to the public, the MDAs, to also access and learn. Monthly and quarterly release of macroeconomic indicators. We have 28 of that. Press releases to commence international days, 14 of that. And then district multidimensional poverty index scorecard for all the 261 districts, in addition to the district league table, which were 6. This year, GSS is conducting 3 equally significant surveys, with 2 already underway: the Integrated Business Establishment Survey and the Core Agriculture Survey. The 8th round of the Ghana Living Standard Survey will be rolled out in the course of the year. Thus, GSS is on course to ensure it continues to deliver on its core mandate and to lead in the production of official statistics. Distinguished ladies and gentlemen, in our pursuit of achieving the Sustainable Development Goals, credible statistical information is essential for effective policy interventions. Therefore, the release of the 2022 GDHS report is timely, providing current information on the health situation of children, women, and men. This report serves as a valuable resource, contributing significantly to informed decision-making aligned with our SDG objectives. We hold a strong belief that the insights derived from the survey will furnish us with pertinent and up-to-date information crucial for monitoring Ghana's progress towards the 2030 agenda. These findings are anticipated to play a pivotal role in assisting policy planners to enhance both access to and then quality of health-related services in the country. I would like to take this opportunity to extend my sincere appreciation to the government of Ghana and all our esteemed development partners for their unwavering financial support and continued interest in the activities of the service. I also extend our heartfelt gratitude to the various ministries, departments, and agencies and other institutions that have supported the DHS in diverse ways, contributing significantly to the success of 2022 GDHS. Special acknowledgements and thanks go to the project implementation team led by Dr. Pepra, ICF colleagues, facilitators, and secondary editors who supported the training and field work. Many thanks also go to the writers, field data collectors, and our valued respondents. Your support is truly appreciated. Our profound gratitude goes to the steering and technical advisory committees for their leadership roles in this endeavor. Lastly, the ever-supportive media colleagues who assisted in our publicity and dissemination activities. We are grateful. Thank you all.
Thank you very much for the warm welcome and for giving us a glimpse of what your directorate is doing at the Ghana Statistical Service. Abana Asamwabia, I say Akotu. Just before I got here, I went to Facebook and I saw myself in the live stream. You can do the same. It's Ghana Statistical Service. We're on Facebook. This event is live, so share it to your friends. Let them know this is where you are. And we are here to launch a really important report. We'll now take a statement from the USAID. Let's welcome the Health Officer Director of the USAID, Dr. Zora Balsara.
Good morning, everyone. Good morning. Professor Samuel Kobina Anim, Dr. Patrick Kumar Boaje, development partners, WHO representative, friends from the press, ladies and gentlemen. Good morning once again. I am, of course, very excited to be here today to join you for the official dissemination of the 2022 Ghana Demographic Health Survey. This is the day many, many of us have been eagerly awaiting since we started planning the survey a few years ago. The United States government, through the United States Agency for International Development, otherwise known as USAID, is dedicated to our long-standing partnership with the government of Ghana and the people of Ghana, which has been spanning over 7 decades now. In 2023, US bilateral development support totaled over $250 million across the health, economic growth, education, and governance sectors. At the core of our mission lies a deep commitment to quality, reliable, and valid data, which of course informs where we work and what we want to do. The DHS is a critical source of data for the health sector. It helps us understand sector trends to improve program planning and interventions. The results of the 2022 Ghana DHS show that while we have made a lot of progress, there is still some work to be done. Here are some research findings. Out of every 1,000 children between the ages of 1 and 5, 40 unfortunately are still passing away. While this is a significant improvement from 60 in 2014, it's still higher than the Sustainable Development Goal target, which aims to reach fewer than 25 per 1,000 live births. neonatal mortality, meaning deaths happening in the first month of life, have also decreased from 29 deaths per 1,000 live births in 2014 to 17 deaths per 1,000 live births in 2022. This is actually quite impressive. But of course, Ghana still has more work to do to achieve the Sustainable Development Goal target of 12 per 1,000 live births. There are two other indicators that really caught my attention. The first one being the rate of wasting, where a child's weight is lower than their height, rose from 5% in 2014 to 6% in 2022. Poor nutrition stunts a child's growth and development, impacting their future earning potential and the long-term development of the nation. We absolutely must renew our efforts to combat malnutrition, particularly in northern Ghana, where the rates were found to be the highest. Adolescent pregnancy is another area of concern. Over the last decade, progress has actually stalled in this area. The adolescent pregnancy rate has increased from 14.2% in 2014 to over 15% in 2022. Teenage pregnancy not only jeopardizes a young woman's health, but also her future, her education, her earning potential, her overall well-being, and Ghana's economy. There is the need to intensify adolescent sexual and reproductive health and education, and access to contraception to help young Ghanaian men and women to make informed decisions about their future. In addition to some of these areas where we continue to work, our health investments have really also resulted in significant progress. Malaria prevalence among children under 5 have reduced from over 26% in 2014 to 8.6% in 2022. And we only just celebrated this a few days ago in Ghana. Our concerted efforts to eliminate malaria are saving lives. Through the President's Malaria Initiative, over the past 16 years, the United States has worked with the Ghana Health Services National Malaria Elimination Program to deliver millions and millions of bed nets, rapid malaria test kits, malaria medication, including preventive therapy for pregnant women and children under 5. We've scaled up laboratory diagnostics, trained health staff to improve the quality of malaria services, and supported social and behavior change. Together, we are making strides to prevent malaria and encourage early treatment. As we delve into today's data, let's remember that behind every statistic is a person, a family, and a future. I'd like to thank the Ghana Statistical Service, the Ministry of Health, the Ghana Health Service, and all other sector ministries for your exemplary leadership and technical expertise in conducting and completing this survey. And most importantly, and I think the speaker before me, Abina, also mentioned this, let me thank all the respondents who took considerable amount of time from their schedules to respond to this survey. This represents over 15,000 women, 7,000 men, across more than 18,000 households across Ghana. Your contributions will help plan for a healthier future. Thank you.
Thank you very much, Dr. Balsara, for your statement. If you missed it, you can just go and rewind the stream and you see her there on Facebook. We will now take a statement on behalf of the 2022 Ghana DHS funders, and representing the WHO Ghana representative is Dr. Shamila Larif. Let's welcome her.
Thank you very much, Mr. Chair. The government statistician, Professor Samuel Kobina Anim, the deputy government statistician, and his representative, Dr. Faustina Frempong. Please, I'm very sorry if I cannot present. Like she said, I am new to Ghana, so please pardon me if I cannot pronounce it really well. Yeah, but I will learn in time. The Director General of Ghana Health Service, Dr. Patrick Abogie. Representative of USAID, Dr. Zora Bolsara. Development partners here present, head of departments and agencies, heads of research institutions, ladies and gentlemen. I'm presenting this on behalf of Professor Kasolo, who is someone who has been quite excited and would have been very happy to be here. Unfortunately, he's out of the country. On his behalf and the GDHS 2022 funders, the World Health Organization is very pleased to be here for the release of the 2022 GDS results. We would really like to congratulate the Ghana Statistical Service for conducting this important survey and releasing the result in one of the shortest time a country in the West African sub-region has done. This is the first time a DHS result has been released within a year, and really it's kudos to that. Really deserves an applause. The Ghana Statistical Service, GSS, through the support of key partners, of course, including the USAID, UK FCDO, WHO, UNICEF, COICA, UNFPA, Global Fund, and the World Bank, has implemented the 2022 Ghana Demographic Health Survey, which is an essential public-based survey that is used to monitor progress on service utilization and management to inform decision-making. The Ghana Demographic Health Survey will add to the large and growing international database of population-based indicators, including the measurement of 44 Sustainable Development Goals. In 2018, the WHO's core assessment indicated that only 64% of data was available for the measurement of the 44 SDG goals. Today, with the release of this GDS and other surveys such as the Harmonized Health Facility Assessment, the STEP survey, among others, we can confidently say that Ghana will meet all the 44 SDG measurement data availability. The GDHS surveys will provide information on mortality, morbidity, nutritional status, disease prevalence, and service utilization, and health-seeking practices, both at the national and subnational level. DHS has been an important source of information to the Ministry of Health to measure outcomes and impacts of health programs, and have been used to develop annual and sectoral plans. There are several opportunities, therefore, to use the data from the GHS for action. Currently, there is limited or no data platform on national, regional, and district level accessibility to health services across the country. However, with this DHS that has been completed, the Harmonized Health Facility Assessment in 2022, and the 2021 National Population and Housing Census, a unique opportunity exists. This unique opportunity is to triangulate and analyze these data sources to provide better information on service utilization and access to care. Going forward this year, WHO and UK FCDO will further support the GSS and the Ghana Health Service to conduct this analysis and ensure that we are able to integrate this survey data. On behalf of Professor Kasolo and all GDHS co-funders, I congratulate Ghana Statistical Service for this immense feat for producing these results within the year. And we hope that going forward, Ghana will use this data as an important source of information to the Ministry of Health to measure outcomes and impact of health programs, and use to develop annual and sectoral plans. Congratulations, GSS. Congratulations, GHS. Congratulations, Ministry of Health. And congratulations, Ghana. Thank you very much.
Thank you very much, Dr. Larif. Jeff, merci. Thank you for your statement. We will now have a presentation of the 2022 Ghana Demographic and Health Survey report. And at this point, I would like to ask all our dignitaries on the dais to step down to have a seat there, minus the Director General. Sorry, minus the government statistician. That's when you have too much banana cake, you speak like that. The government statistician is going to do the presentation, and I'll have our screen come down while our guests make their way over to sit and watch. So let's welcome Professor Samuel Kobina Enim, government statistician. It's coming down. Yeah. Your computer. Yes, I think it's just that way. Let's see what happens. Let's see.
Is it the outline? Thank you very much, Kafui Day, for emceeing the program for the Ghana Statistical Service release of the Ghana 2022 Demographic and Health Survey. The Director General for the Ghana Health Services, representatives of USAID, WHO, and I've also spotted the representative of UNFPA, all other development partners that are joining us for this release, distinguished colleagues within the Ghana Statistical Service, and specifically those who worked tirelessly to ensure that we have this report within a year, as has been indicated by our representative from WHO, and our invited guest. Good morning. I don't feel the response. Good morning. Good morning. Thank you very much. So I have the pleasure to do the release of the 2022 Ghana Demographic and Health Survey. Colleagues, what I intend to do is slightly different from what we've been doing in the past when it comes to release of reports. I must indicate that in 2023, we did a release of the key indicators report that focused on the thematic areas as was shared with us by our Director for Survey Census Organization. In this release, what we intend to do is to take home a story that says that health improvement is a shared responsibility. So it's important we look at it from the perspective of access and think through it whether the access as a result of individuals not getting access of it are constrained or are constraints from the side of government, and more importantly, look at issues around behavior, and then launch you into the status of our health statistics, and highlight two drivers that in our minds are critical when it comes to issues of access and behavior. Then I'll leave you off with some takeaway messages. So in terms of background, as was indicated by the Director of Survey Census Organization Directorate, we're not doing statistics or producing statistics in isolation, and we always want to produce statistics having in mind the policy goals that is going to achieve. So when we're drafting the instrument, our engagement with USAID right from day one, and other development partners for that matter, reflected on the number of sustainable development goals, statistics that we're going to produce after this survey, and more importantly, our own health sector medium-term development plan, which ran from the period 2022 to 2025. So this is the context in which we did the Ghana 2022 Demographic and Health Survey. We've heard about the number of indicators that we are going to measure from the Sustainable Development Goals, but broadly out of the 17 Sustainable Development Goals, this report is giving us data on 7 out of the 17 Sustainable Development Goals. All the first 6 goals running through when we want to completely do away with poverty, no poverty, which is our first Sustainable Development Goal. The second Sustainable Development Goal, which is about zero hunger. The third Sustainable Development Goal, which is directly related to this survey, which touches on good health and well-being, has elements on quality education, has elements on gender equality, and the 6th Sustainable Development Goal, which talks about clean water and sanitation. Most importantly is the 17th Sustainable Development Goal, which from the perspective of some of us, it is the driver of the first 16 development goals, which has to do with partnerships. How we can form partnerships to ensure that we get through with the first 16 Sustainable Development Goals. So this is the lens from which we looked at the Demographic and Health Survey. It was indicated earlier on the scope of the survey. I'm not going to run through it. It runs through from nutrition and ends with the drivers that we think are policy triggers for policymakers. A bit on the methodology, and I'm going to highlight on the new things that we did in the 2022 Ghana Demographic Health Survey. So definitely it's nationally representative. It covered all the 16 administrative regions. It used the 2021 Population and Housing Census as the base. What was unique about the 2022 Ghana Demographic and Health Survey is the fact that the 618 clusters that we use for identifying the households can be found in all our 261 administrative districts, a practice that hitherto we were not so conscious about. But this time we're very conscious about, because we just don't want to do a one-off release. What is going to happen after this release between the months of April and December 2024 is doing specific district-level analysis of all the national and regional indicators that we have using small area estimation, so that we can get granular data to inform the kinds of things that we want to change as a country. We are pretty okay with the national and regional figures, but the only way we can get to the root of eradicating the challenges that we have from the health sector perspective is when we have access to granular data. And that is why we thought that the 618 clusters that we have for the 2022 Ghana Demographic Health Survey should have a representation in all our 261 administrative districts. Consistent with previous demographic health surveys, both in Ghana and other geographical jurisdictions, we focus on women 15 to 49 years. We target half of these women, men 15 to 59 years, and the three main respondents are men, children, women, and men. And this is where we do the anthropometry, anemia, and malaria, where we do on-site testing of it. As was indicated, data collection started from October 2022 and ended in January 2023. And for that matter, within a year, we are releasing the results of the Ghana 2022 Demographic and Health Survey. I take this opportunity to endorse the appreciation to respondents for participating in this survey. We had a resounding response rate of 99.3% for the household interviews, resounding response rate for women, 98%, and resounding response rate of 97% for the male interviews. But for that, we couldn't have done this survey and come up with these results. So as I indicated in my introductory remark, the story for the release is woven around access to health services, behavior to health services, where we are, not necessarily on selected indicators, and the drivers for which we need to look at our health status. So we start with travel time to nearest health facility for women aged 15 to 49 years, and do the disaggregation at four different time periods: less than 30 minutes, 30 to 59 minutes, 60 to 119 minutes, and beyond 2 hours. We identify that about two-fifths, that is in excess of 40% of women aged 15 to 49 years were traveling in excess of 30 minutes to access the nearest health facility. This puts into context the government's intervention of Agenda 111 and where it is being situated, and the extent to which it's going to address the fact that we have people traveling in excess of 30 minutes, specifically 40% of people traveling in excess of 30 minutes to access the nearest health facility. Of importance to us is the disaggregation across the 16 administrative regions. and from the perspective of those traveling more than 2 hours to access the nearest health facility, where we identify the OT region having more than 10% of women aged 15 to 49 years traveling in excess of 2 hours to access the nearest facility. The range is from 0.8 in the eastern region to 11.6%. This is where the conversation around the citation of the Agenda 111 should be reflected. As in, is it dominant in these places where we see a lot more people traveling in excess of 2 hours to access a health facility? The other access indicator that we look at is whether persons in Ghana are conscious about regular checkups, and over the 6-month period preceding the survey, the proportion of people that took the decision to say that it is important to visit a health facility to check my health status. Of persons 15 to 49 years, we are just 32.4% of females doing that, and males, we had just 20.4%. From the perspective of these people who did it, whether we are taking full advantage of the NHIS card is a conversation that we should be reflecting on. And of the 32.4% of females, pretty low, just about a third of females who decided to visit a health facility over the 6-month period preceding the survey, just 23.6%, less than a quarter of that, used the NHIS card. And in the case of males, the situation was not something that we can boast of, as we had just 9.2% of that doing the visit with a health facility. From the perspective of sex, we saw that more women were doing that than males. In the case of females, we saw variations across the different age brackets, 15 to 19 years, up to 45 to 49 years, with the highest being within the age bracket of 25 to 29 years. We didn't observe significant differences across males for the different age brackets. Menstrual hygiene for females 15 to 49 years. Let's keep in mind that we're talking about access. We selected 2 out of the different modes of menstrual hygiene, specifically disposable sanitary pads and cloth. Disposable sanitary pads was the dominant. We had just about 11.6% of females 15 to 49 years that were not using disposable sanitary pads, which means that we had 88.4% of them doing that. The second dominant engagement with menstrual hygiene was the use of cloth, where we saw close to 10%, specifically 9%, out of the 11.6% that were not using disposable sanitary pads using cloth. So cloth was the next alternative. And concerning again here are the regional differences, where we saw as high as 34.2% in the northern region, in excess of a third of it, to a lowest in the Greater Accra and Bono regions, which jointly recorded 1.7%. Again, emphasis here is on the disaggregations, and emphasis here is on access. And let's think about access from 2 different perspectives, whether they are available or not, from the government side, or the choices that individuals would have to make. I turn the conversation to behavior. Seeking advice or treatment for fever in children under 5 years. 2 things. Whether caregivers are conscious of the fact that it is important to seek advice, and here when we talk about seek advice, it's not just anybody on the street that you seek advice from, but you seek advice from an appropriate outlet, either a public or a private government institution or a private institution. Over the period of the survey, 2 weeks before the survey, we had 15.1% of children that recorded having fever over the 2-week period preceding the survey. we had only 57.1% of them that sought advice or treatment for the situation of the child. And there was a delayed action, as we got only 32.6% of them doing that either in the first day or the second day. This is a behavioral issue. Health is a shared responsibility. The concern here is further exposed when we look at the different age categories of children that had the opportunity for their treatment, for their situation, to receive some advice. And we realize that with the exception of children 36 to 47 years, the seeking of advice increases with age. As we recorded, just 45.9% for children 0 to 6 months, to as high as 65.8% for children between the age bracket of 48 to 59. This behavioral issue puts children 0 to 6 months at more risk relative to children 48 to 59 years. In terms of sex, we saw higher males in terms of children that benefited from such an advice relative to females. The storyline was not different with diarrhea. Over the period, 9.2% of children were recorded as having diarrhea, and out of that, in the eastern region, that recorded 12.7% that recorded diarrhea, and out of that, it was only 50.5% that had the benefit of advice or treatment being sought by the caregiver. This is a behavioral issue. Again, we didn't see significant differences across males and females, and slightly linear difference across the different age bracket, as we recorded 30.6 for children 0 to 6 months, up to 62.6% for children within the age bracket of 48 to 59 months. Again, these variations across the different age brackets puts children within the age bracket 0 to 6 months at a higher risk relative to those 48 to 59 months. Dietary diversity on healthy food consumption for women 15 to 49 years. While we reflect on this behavioral issue, let's keep in mind an outcome on obesity as we show the status on that. So minimum dietary diversity, from the survey, we had 10 different groups ranging from grains, vegetables, flesh, food, up to leafy vegetables, and so on. And the definition of the minimum dietary diversity are women who are consuming at least 5 out of these 10 groups to expose them to the diversity and the richness across this diversity. We have just 50% of women within the age bracket 15 to 49 years that are consuming 5 or more of these 10 different groups. So definitely there will be some deficiencies given the variety of consumption associated with it. The other side is women 15 to 49 years that are consuming unhealthy food. And the definition of unhealthy food here is those of us associated with cakes, chocolates, toffees, fried plantains, French fries, all the things that we fry and are sweet in our mouths. That is what we defined as unhealthy food consumption. We had more than a quarter of our women, specifically 27 to 7%, that were consuming this unhealthy food. We looked at this at the different age categories for these women 15 to 49 years, and the significant observation had to do with those consuming unhealthy food. As you see, it decreases across different age brackets. One can argue that some learning happens as our women grow older. So you see a very high percentage for our women within the age bracket 40 to 49 years, having 40.7% for women 15 to 19 years, and reducing significantly to 18.0% for women within the age bracket 40 to 49 years. Another behavioral issue that we touched on, which has to do deworming among children 6 to 59 years in the 6-month period preceding the survey. So we have less than 50% of our caregivers deworming children 6 to 59 months old, specifically 46.3%. This was relatively higher for children within the age bracket 24 to 59 months relative to children within the age bracket 6 to 23 months. We didn't find any significant differences for children by sex. We turn to status. Starting with nutrition. Director General, this is the 3rd time Ghana Statistical Service publicly is announcing the status of children that are stunted from the 2022 Demographic and Health Survey. We keep emphasizing this because, as you would agree with me, out of the 3 anthropometrics, this is more of an outcome rather than the issue of wasting and underweight. And we all know how this is related to cognitive behavior. The health sector medium-term plan puts the target at 16.0 for 2022. Currently, from the 2022 Ghana Demographic and Health Survey, we are doing 17.4, which means that we are yet to get to the 2022 target. Distinguished ladies and gentlemen, we emphasize this because the Sustainable Development Goals argues that by 2030, all forms of malnutrition should have been eradicated. At this rate of growth, from 32.5% in 1993 to 17.4% in 2022, clearly we are going to miss the target of eradicating stunting by 2030 with a current rate of 17.4%. Distinguished ladies and gentlemen, we will continue to emphasize the disparities. The disparities from the stunting point of view shows close to about three times difference between the region that is recording the highest rate, that is the northern region, 29.6%, and the region that is recording the lowest, that is the eastern region, 10.4%. It is about time we try to focus on district-level interventions to ensure that we have a balanced health improvement across our 261 administrative districts and 16 administrative regions. We see a slightly suggestive relationship between age and stunting, as we record lower rates of 13.2% and 11.5% for children, respectively, within the age brackets of 0.6 months and 6 to 11 months, relative to 24.6% for children within the age bracket of 24 to 35 months. Significant variations is observed across the sex of children, with more males being stunted, specifically 19.4%, relative to 15.3% for females. Overweight among children. Over the period 1993 to 2022, close to 3 decades, as a country, we've made only a 0.5 percentage point gains in overweight. In 1993, we had a prevalence of overweight of 2.5%, and in 2022, a prevalence of 2.0%. More concerning is the regional differences. While nationally, we are seeing a drop of 0.5 percentage points, as many as 9 of our 16 administrative regions over these 3 decades, 1993 to 2022, we have seen an increase in overweight, children who are overweight. So this is a retrogression, and clearly is not consistent with the SDG goals, and clearly is not consistent with our own health sector development plan. So one of the key messages that I leave you with is the need to identify areas that we are retrogressing, of which it wouldn't be a matter of acceleration, but it would be a matter of deploying different interventions. Prevalence of anemia in women 15 to 49 years. So women that are low on red blood cells and hemoglobin, using the threshold of less than 11, 12, 13, whether you are pregnant or otherwise. Not looking at only the levels, which is suggesting that more than 2/5 of the women that we interviewed were anemic, but more importantly, the progress that we've made over the period 2003 to 2022, a 19-year period, or close to 2 decades. In 2003, we recorded 44.6% of our women that were anemic, 15 to 49 years. Over this 2-decade period, 19-year period, we've made gains of only 3.5 percentage points, dropping from 44.6 to 41.1 in 2022. I did mention earlier on the consumption of unhealthy food and what we see with obesity among adults. The first story is that half of our women are either overweight or obese, specifically more than 1/5 of them being obese, 22%, and 28% of them being overweight within a BMI of 25 and 29. The situation between females and males is about 2 times, as we do record 20.7% of males that are either overweight or obese, relative to half, that is the 50.2% of females that are either overweight or obese. In the context of males, we have 3.9% of them that are obese and 16.8% of them that are overweight. This varies and increases with age, our lifestyles, and health outcomes. Prevalence of obesity across our 16 administrative regions. Across our 16 administrative regions, we're recording Greater Accra 35.6%, either obese or overweight, and also Greater Accra region 61.3%. Later on, you're going to see the slide on poverty or wealth status and education on these health outcomes. Again, stark regional variations are observed, and one of the major observations here across the 16 administration regions are the wealth status of these 16 administrative regions, with a few exceptions like Volta. As you see Greater Accra on top, and you see 3 of the 5 regions in the north at the bottom, specifically Northern, Upper East, and Northeast. Reproductive, maternal, and child health. Director General, you will recall that in my last engagement with the Ghana Health Service, one of the issues that we talked about had to do with maternal mortality ratio. And we did indicate that we're still far off the SDG target, which talks about 70 deaths for every 100,000 births. And we identified the inputs that would ensure that we minimize maternal mortality ratio, one of which is births that are attended by a skilled health personnel. Clearly, we've gone past our health sector medium-term target, which is 60%, and we're seeing significant percentages across different age brackets, 88.3% for those less than 20 years, 88.4%, 20 to 34 years, and 84.2% for those 35 to 49 years. So across all the different age brackets, we've exceeded our national target. Again, emphasis is whether this is across our 16 administrative regions or otherwise. Nationally, we are seeing a change of more than a double of what we had in 1988, increasing from 40.9% to 87.6%. But these rates are not consistent across the 16 administrative regions. The region that saw the highest change over the period 1988 and 2022 was the Upper East region that skyrocketed from 17.0% to 98.0%. This was not the case in other regions that saw relatively marginal change over the same time period. Neonatal mortality rates are children that do not celebrate the 28th day of birth. That is, children who die before their 28th day of birth. Director General, we've made progress, we've met our target, but we're still recording 17 of such children that are dying, that is out of every 1,000 live births, that are dying before their 28th day of birth. What is concerning again, and I'll continue to emphasize the need for granular data, is the distribution across the 16 administrative regions. Distinguished ladies and gentlemen, 5 of our 16 administrative regions have not met our own national target of 24 deaths for every 1,000 live births. Specifically, the OT region, Savannah region, Volta, Upper East, Western region are doing in excess of 24 deaths for every 1,000 live births, with the OT region recording the highest of 32 deaths for every 1,000 live births. Under 5, mortality. We've made progress on that in the sense that we've met our health sector medium-term plan target of 55. The emphasis here again is on the regional disparities. We do record 2 of our 16 administrative regions that are yet to meet our own health target of 55, specifically 72 for OT region and 63 for the Savannah region. The disparity is stark when you look at the Greater Accra region, which has an under 5 mortality of 20, which is about 3 times that of the OT region, which is 72. Women 15 to 49 years who have their need for family planning satisfied with modern methods. That is, women who are able to limit and space their births by using the appropriate modern methods. Just about a half of that, specifically 49.5%. Again, variations over time is what we do emphasize in this presentation. As a country, we've doubled this proportion of women who are able to limit and space births using modern methods from 22.2% to 49.5%. The change over the 16 administrative regions is different. Is different across the regions. The Upper West region had about 4 times the difference, increasing from 15.7% to 61.7% relative to the national change of 20.2% to 49.5%. Indeed, in some regions, as is expected, the change was more than double over the period 1993 to 2022. I'm happy 2 earlier speakers did talk about Ghana's intervention in the area of malaria. Significant progress has been made over the 8-year period 2014 to 2022, specifically decreasing from 26.7% to 8.6%, about a third drop of the rate that we had in 2014, which should be commended nationally. But while we see a national decline of up to a third of the rate in 2014, in one of our administrative regions, we've seen an increase over the 8-year period, specifically in the Upper East region, where we recorded an increase from 11.7% to 12.2%. It is clearly important that our decentralization effort should be strengthened. Our Ghana Health Service, Ministry of Health, have put together a national schedule for children that should be fully vaccinated. Nationally, we still have about 2% of our children that do not have any vaccination. But what is important for us is regions that we are seeing retrogression in the proportion of children that should receive the full vaccination according to our national schedule. Specifically, we identify 5 administrative regions that over the period 1993 to 2022, we see a retrogression in the proportion of children that should be fully vaccinated, some of which include the northern region that retrogressed by about 8 percentage points from 39.1 to 31.2 over the period 1993 to 2022. Domestic violence. This is measured from 3 perspectives, either emotional violence, physical violence, or sexual violence. In this presentation, we're going to highlight any form of these violence. From the 2022 Ghana Demographic Health Survey, we identified 28.4% of our women that have experienced either physical, sexual, or emotional violence. Obviously, how we've measured this over the period is, or how we've performed over the period is the emphasis. While we see that nationally, there has been a decline from 33.6% to 28.4%, the story is not the same across the 16 administrative regions. Indeed, there were 4 of the 16 administrative regions where we saw any form of this violence increasing. We saw the Hafo region increasing from 36.4% to 38.5%. We saw the Volta region increasing from 25.3% to 36.3%. We also saw increases in the Western and Western North regions, increasing respectively from 21.3% to 28.2%, the highest retrogression, and for the Western North region, retrogressing from 21.3% to 25.8%. So in these 4 administrative regions, the incidence, the prevalence of violence, either from an emotional point of view, a physical point of view, or a sexual point of view, over time is increasing. We looked at this from a trend perspective, and across the 3 domains that I talked about, while we see a decline in emotional and physical violence, from the sexual violence point of view, we see an increase of 1.1 percentage points nationally. Also, this varies across the different age brackets. Our women who are marrying at a young age. We look at this from 2 perspectives. Children marrying before age 15 and those marrying before age 18. With our national target of 4.0% by the end of 2024, based on the 2022 Ghana Demographic and Health Survey, the current rate of 3.3% is lower relative to the national target of 4.0% for those less than 15 years. For those less than 18 years, the national target of 17.0% and the current rate of 16.1% is still suggestive that we are doing less than ending child marriage by 2024 for those less than 18 years. What is important is looking at this from the lens of the Sustainable Development Goals. From the lens of the Sustainable Development Goals, these vulnerabilities should be eradicated completely by 2030. If you look at the rate of change since the 1998 Demographic Health Survey to the 2022 Ghana Demographic Health Survey, there is no way we can reach that SDG goal of eradicating this form of early marriage either under age 15 or age 18 by 2030. Decision making, women empowerment across the 16 administrative regions and for different age brackets. So women who are able to make informed decisions regarding sexual relations, contraceptive use, and reproductive health care. We have 51.7% of women who are able to make their own informed decisions, just about half of that. What is important is the regional disaggregation And again, in the Northeast region, you have less than a third of these women relative to the national figure of 51.7%. The situation in the northern part of the country is not as we see in the southern part of the country, with the exception of one or two isolations. But what is concerning is the Northeast region, which is significantly lower than the other 16 administrative regions, with just less than a third of the women who are able to make informed decisions on matters related to sexual relations, contraceptive use, and reproductive health care. Distinguished ladies and gentlemen, I turn to the drivers. We're going to go into issue-based dissemination, and for each of the issues, an attempt will be made to look at the different drivers of each of the issues. But for this release, we focus on individual and maternal education. What is interesting here is how education relates positively with malaria among children under 5 years and stunting for children under 5 years. What you see is that higher levels of education is associated with lower levels of prevalence in malaria and lower levels of children that are stunted. The reverse is observed, and this is where the behavioral issue should be looked at, where education is related positively with obesity. And on the other side, as expected, from an education point of view, we see a positive association between women with higher education and their menstrual hygiene, increasing from 95.3% for those with no education to 99.0% for those with more than secondary education. Access behavior. The second driver that we looked at is household wealth quintile, and consistent with our observation from the perspective of education and health status, you see a positive association between wealth and malaria prevalence and stunting, where you see those in the richest wealth quintile having lower levels of malaria prevalence and stunting. A behavioral issue, those in the higher wealth quintile having higher incidence of obesity, and also seeing an association, a positive association between higher wealth status and menstrual hygiene. Distinguished ladies and gentlemen, on account of what we've seen from the perspectives of access, behavior, and status, our takeaway message is health improvement is a shared responsibility between individuals and the state. We've clearly shown evidence of retrogression in some health sector indicators. Regional variations are stuck across several health indicators. Wealth and education remain key drivers in addressing our health challenges from both the individual perspective and the state perspective. Focusing on the 7 SDGs, specifically 2, 3, 5 that I talked about, it's important for us to identify areas that we need to accelerate and areas that we need to have a different direction if we want to address those health issues. Thank you very much.
Government statistician, Professor Enim, thank you so much. Can we have this up, otherwise he can't see you. Thank you. And then we bring back the occupants of the high table to not make him feel too lonely. So please come back and join him. Thank you very much. That's a lot to chew on. So we have armed them with a copy each of the report. So if you could please grab your report, and we will launch it. Yes, so. So can we have them kindly stand and hold it like they've won the World Cup, you know? But don't hide your faces to the side, to AFCON. Let's make it AFCON. Let's bring it home. Like we've won the AFCON, since Ghana is playing today. Yes. So on this day, the 18th of January, 2024, they want to see your faces. We are pleased to have Professor Samuel Kobina Inim, Dr. Patrick Kuma Abuaji, Dr. Zara Balsara, Dr. Shamila Larif, and Mrs. Abana Asamwabia Osei Akoto duly launched the 2022 Ghana Demographic and Health Survey Report. Can you see their faces? Yes. Yes. Holding it like the captain of the Black Stars. Thank you. Duly launched. Thank you so much. This is the picture you see in tomorrow's Daily Graphic and other papers. Indeed. And tell them you were here some. Okay? So now that the report has been launched, we would love to hear from the Director General of the Ghana Health Service. Let's welcome Dr. Patrick Kuma Abuaji. Hello, sir. Happy New Year. Good to see you. Yes. So I'll take this off. Yeah.
Thank you very much, Kafride. I think there's a lot to chew on, and I don't know whether I can respond to all, but I'll do my best. Government Statistician Prof. Anim, thanks for your wonderful presentation and the detailed analysis you gave us. Director, Health, Nutrition and Population, Zora Basara. Dr. Shamila, representing the WHO rep. Dr. Winfred Ochan of UNFPA, the UNFPA rep. Other partners, directors from the MOH and GHS, friends from the media, ladies and gentlemen, I want to acknowledge anybody who I have missed. I think today we have been given a lot of information. I've been to many disseminations, and I can say this is different. We must really. And so I'm delighted to be present here for the official release of the results of the Ghana Demographic Health Survey 2022. This marks the 7th edition of the survey since its inception in 1988. I don't know where some of you were. Over the years, these surveys have played a pivotal role in shaping health policies, enhancing healthcare delivery, and addressing the diverse health needs of our population, and thereby ultimately contributing to the overall well-being and development of our society. I would like to acknowledge that this survey has been the result of close collaboration among various stakeholders and the active participation of key organizations in Ghana health sector. I extend my gratitude to our partners who co-financed this endeavor alongside the government of Ghana. I must leave a special thanks to the USAID, the US President Malaria Initiative, UNICEF, UNFPA, the World Bank, Global Fund, COICA, WHO, UK Aid, and the Foreign and Commonwealth Development Office. Additionally, I express appreciation to the ICF for their valuable technical assistance. A note of commendation is also due for our collaborating partners and the staff of the Ghana Statistical Service and all the many data collectors who went across the country. Ladies and gentlemen, we take pride in a decade-long partnership with these key stakeholders, which have significantly benefited our service, the Ghana Health Service, and the service sector of health, and the entire health sector, This high-quality survey has provided essential data on fertility, mortality, family planning, maternal child health, nutrition, and disease prevalence. This information has been instrumental in evidence-based health planning and policy formulation. Ladies and gentlemen, through understanding the demographic and health needs of our population, we have improved resource allocation, designed new initiatives, and implemented programs to address maternal, infant, and young children, adolescent health, and nutrition, aiming to reduce mortality and morbidity in line with national and global targets. I want to digress here and say that, yes, we have not achieved our aims and our targets, and that is because Ghana has very high standards and we have high expectations. I'll give an example. I was called in Canada to receive an award for reducing maternal mortality within that purview, within a very short time, relating to some aspects of maternal mortality. But I must tell you, that very week before I was gone, I was called by Parliament to explain to them why maternal mortality remains high. Just a week after that, I went to receive an award. I think we must keep the drive and make sure that we set high bar for ourselves so that we can also achieve the health needs we have. Ladies and gentlemen, the DHS has been pivotal in understanding the prevalence and distribution of diseases, crucial for planning and implementing prevention and control strategies, especially in the context of emerging health threats, as you have seen in the last few years. We are gratified to see positive outcomes with substantial progress achieved in 6 out of the 15 targets of the 2022-2025 Health Sector Medium-Term Development Plan, utilizing these selected indicators from the DHS 2022. Ladies and gentlemen, these achievements include improvement in our total fertility rate, prevalence of childhood anemia, stunting, even though it's still very high, we've got some small reduction. I might just add that stunting is one of the greatest outcomes of our many sins. That is nutrition, our sanitation, open defecation, etc. They are all contributing eventually to stunting. Infant mortality has come down, but we are also happy that we've been able to reduce our neonatal mortality, which is a very, very resistant data, especially when it starts dropping below 25. The under 5 mortality also has gone down. However, challenges persist as evidenced by the increase in teenage pregnancy rates and the percentage of underweight children under 5. While some targets have been met nationally, it is concerning that several regions fall short, showing substantial regional disparities for almost all indicators, including skill delivery, the percentage of children without vaccinations, and stunting. In the face of these challenges, our service commits to providing strong leadership and clear guidance to ensure coordination among multiple partners of the sector. I must say that the regional disparities also show gross disparity among the newly created regions, which we see also as that. And that's why Ghana Health Service moved in there very early to ensure that we are able to focus on these deprived areas. And we are hoping that the next DHS will show better results in these areas. So we pledge to deliver high-quality essential services at both the facility and the community levels. But will require the support of our media and the entire population to ensure that this is done, because health is we give, but also people have to take. We have the demand and supply. We are responsible for supply, but we ensure that the demand also improves. Ladies and gentlemen, this survey underscores the urgent need for improvement in various areas, and we look forward to working collaboratively with our partners and stakeholders to strengthen the health system in Ghana. Furthermore, as I conclude, we will continue to advocate for increased domestic funding to implement our shared priorities in the health sector and continue to improve access to essential services for all as we work towards achieving the UHC. And I believe that we must say that this is our challenge and we must take the lead as a country in addressing our health needs. Thank you very much.
Many thanks, Dr. Kumabwaji, Director General of the Ghana Health Service, for your remarks. We're now going to test to see whether you were following the presentation by the good professor. So it's now time for some questions. 5 related to the presentation. So just raise your hand. I'll bring the microphone over. Your name, your organization, and then a brief question or comment. Who's going first?
Hi, I'm Kenneth with Joy News. I want some bit of clarity on the obesity statistics. I want to find out how prevalent it is within rural and urban centers. And also, the ages were 20 to 49. Did you conduct above 49 upwards? If you did, kindly share with us.
Okay, so that one jumped out at me as well. Obesity, that's 1. There's a lady here, 2. Gentleman over there, 3. Yes.
Okay, thank you. Thank you, Doctor. My question goes to Director General of Ghana Health Service. My name is Eunice Lawe from Ministry of Parliamentary Affairs. In your presentation, Professor Enim, you said Ahafo region is the leading region in terms of overweight. That's 4.3%. Can I know the reason, or what's the cause, or is it because of the lack of education? Thank you.
Okay, so obesity 1, overweight 2. Heavy questions.
Thank you. I'm Oswald with Coalition of NGOs in Health. Prof,
Sir.
Thanks for the presentation and kudos to your team as well. My question is with the access. You made mention regarding the traveling time to the nearest health facility. I stand to be corrected. By my understanding, look as though consideration was given to proximity, but then there could be other confounding effects like congestion, motorability, because we all should attest the government have also done well by also bringing up the Agenda 111, which more or less is in response to bring more health facility. But then when we look at the HEFRA accredited health facility, I mean, you take the bird eye view, for instance, in the southern, I'll call it southern western region, STMA, Efia, Kwesimin team, Poho, Shama, and the rest. You could see several health facilities, I mean, HEFRA health facility, so close to each other. When you come to Accra, I mean, within the AMA and neighboring MMDAs, you could see similar.
What's the question, sir? The question.
I just want to build what they call a preamble. So in response, I would want to ask, to what effect were consideration given to motorability and that of the congestion, because addressing that may not necessarily need bringing in more health facilities. So I don't know, and with that...
So you want to deal with access?
Access, yes, and with that...
You should go down, you should drill down into access.
That's why I would appreciate if you give me the chance.
We can't hear the question, sir.
No, the question is, will the policy direction be the same if consideration were given to addressing access and that of addressing access through motorability
awesome.
And addressing the congestion? Would
Thank
that
you.
be the same as building?
Congestion of the hospital or congestion of the roads?
Congestion of the roads.
Okay, all right, so access. 2 more questions and we get some responses from, there's one hand lifted up there. Yes, sir. Name and organization.
Thank you.
Yes.
My name is Stephen Duku from USAID Ghana.
Okay.
And thanks, Prof, for the excellent presentation. So it was good to see the proportion of women that are responding that they are receiving some form of domestic violence. I was also hoping to see a similar statistics for men. Is it because we are assuming men are not domestically abused? It might not be physical, it might not be sexual, but emotional, psychological.
It's like the women screaming on the men, right?
Yes.
All right.
Are suffering in
Okay, so
silence.
abuse.
So maybe that may be another
All right.
statistic that we want to see in the
Okay.
next,
All right, we take a fifth one. A fifth one. There's a hand here, brother. There's a hand here. And then we get some responses. We take 5 and then get some responses. And
Thank
come
you
back.
very much.
Yes, sir.
Professor, congratulations to Ghana Statistics and to you and your team for this report. We also join in to welcome the release of the report because we know its place in guiding our planning and policies. 2 quick ones. One is, or rather the focus is really on the teenage pregnancy that seems to have increased, and also a kind of not clear direction in change on child marriage. From your fieldwork and other engagements, and of course I draw in also the Director General of Ghana Health Service, what do you think could be the factors behind these, and what would be our best approach in accelerating actions on this? The second one is that this is a very useful report. What are the strategies for taking the conversation on this report at the lower and subnational level, especially regional? Thank you.
Okay, so we'll take some responses to these ones. So dissemination of the report, issues on child marriage, teenage pregnancy, domestic violence, access, overweight, and obesity. Can we have the responses over here, sir? Thank you. We'll take another round after the responses have been given.
Thank you very much. Let me go back to the preamble for the presentation. The preamble for the presentation, as I indicated, was structured around access, behavior, status, and drivers. The presentation was not to delve into each of the issues. So any issue that we've talked about today, we've just scratched the surface of it. And when we're going through our roadmap for dissemination, I'm going to walk you through what we're thinking about in terms of specific issues and the depth of analysis that we want to go with those issues. But I can provide quick responses to the issues that have come up. So for obesity, we've disaggregated by urban, rural. I just checked and I can confirm that consistent with relatively well-off areas, we have higher obesity in urban areas than rural areas. Again, this is something that when we're doing our detailed issue-informed presentation, we're going to touch on it. This survey targeted women 15 to 49 years. So the analysis where we cut across men and women, we focused on the age bracket 15 to 49 years. The question on travel is to the nearest health facility is a brilliant question. And that is why Ghana Statistical Service, after the 2021 Population and Housing Census, did the work on proximity to essential health services, of which health was one of it. In that analysis, all that we did was to look at the distances based on GPS coordinates. Further to that, we're looking at issues in terms of road network and so on. What this 2022 GDHS is doing differently is that it's not just relying on what respondents will say when it comes to the travel time. It disaggregates the data based on the mode of travel, either motorized or non-motorized. So the report that we've launched today, if you want to get an analysis on the impact of access on the roads, impact on access in the health facility in terms of congestion, these are all things that you can get if you are able to look at the data in detail, and more importantly, triangulate it with data from the Ghana Health Service. The question on domestic violence is also excellent. It's one of the thematic areas that we're going to do the release on. The beauty about what we've done today is once the micro data is available to all of us, we can define our own ways of domestic violence because we have questions that gives us the opportunity to draw on what we think is domestic violence, either from the perspective of women or from the perspective of men. Indeed, one of the things that I wanted to talk about today, but in the interest of time left out, is the extent to which women are independently able to make decisions on their earnings by themselves. And we have that same question for men, the extent to which men are able to make independent decisions based on their own earnings. This is something that you can pick up and analyze from both the men perspective or the woman perspective. UNFPA, thank you very much for the question on child marriage. Indeed, it's an area of concern to us. That is why we've collaborated to come up with the thematic brief on child marriage. We're going to do the same for the DHS, and with the variety of correlates that we have in the DHS, we can definitely nail down on the factors that are driving child marriage. And as I said, in the next presentation, I'm going to talk about a roadmap for dissemination, which will give you a sense of our thinking of how to get this at a subnational level. Thank you very much.
Thank you very much. I think I'll answer the obesity question. It's all about behavior and maybe access to income with poor knowledge on what is healthy and what is not. And so that is what we need to look at, looking at our behavior and how we can interrogate and also provide further education that people will stay healthy. And especially in a time where we want to, non-communicable disease, the highest killer in the country, it is extremely important that obesity and our nutritional habits is checked. With the harmful one, it's quite strange, but it needs further interrogation, maybe look at their behavior, their eating habits, etc., to see is there anything that is driving such an increase in obesity in that region. I want to touch on the travel time. Over the years, we've moved away from distance to travel time, because the issue is when are you able to get to the place? What is the best way you go, whether you are walking or you are on a motorbike or in a tractor? And so travel time is an important indicator. If you set off, if you have to get to 37 from Adenta at 7 in the morning, you definitely, someone will get to Nkoko before you get to. So travel time is extremely important indicator now in terms of measuring access and how you are able to reach. Okay, I think that's what I want to add to that. Thank you.
So before Professor Nim gives us the closing remarks and dissemination roadmap, there's time for 3 more questions. So first come, first serve. 1. Can we have the microphone go to him? Yes, the gentleman in the bright orange shirt. If he's the only one, that would be the only one we'll do. Okay.
Okay, thank you.
Welcome.
Yeah, please. My name is Abdullah Dasmani.
Right.
Abdullah Dasmani from Peace FM.
Sure.
Yeah, please. During the presentation by the government statistician, Professor Kobna Enim, we saw that in this modern Ghana, some people have to travel 2 hours before getting access to a nearby hospital. So my question is, are there not cheap compounds within those regions, especially OT region, or those cheap compounds have been abandoned?
Okay. So you want to know whether there are chip compounds in those areas. Okay, that's 1.
Are they functioning or?
Are they functioning? 2 more questions. It's a very good question. There's a hand at the back. Gentleman in the light blue shirt. So any ladies want to ask a question? Gentleman in the corner. And if nobody else raises their hand, he'll be the last one. Yes. Yes, sir.
The live birth mortalities that he mentioned, I want to find out if it has any correlation with access to health centers, the sort of status of the people that are dying, and also whether these people go to hospitals or they just stay at home and then deliver their babies.
Okay. And this is the last question in the corner. I'm assuming this is for Dr. Kumabwaji, correct? It is, yeah. It's on the hot seat. Gentleman there, yes, he's the last one. Yes, sir.
Thank you very much. Yeah, the name is Justice. I'm a journalist. So on the issue of sanitary pads. Because recently there's been a movement that I am a part of to get taxes on, sanitary pads removed such that it will be accessible when it comes to pricing for all. So the difference, when you talk about the northern regions where you have the lowest access to sanitary pads, does it have anything to do with the prices? Thank you.
Okay, so 3 questions. Sanitary pads and prices, mortalities, and CHIPS compounds. Dr. Kumamaji, you're good to go? It's like meet the president.
Yeah. Thank you. I thought today was Professor Nim's day, but it looks like, yes, thank you very much. I think the basis of creating a CHIPS compound was just to address the same challenge that we are having. Yes, store access, people are doing 2 hours. What was it before? Many years ago, what was the distance? I have done a study with the former the deputy governor, and we have seen 3 hours, not just to the nearest facility, and also to the most essential, where complication can be managed. And so, yes, there have been improvements. One thing is that some of these facilities, based on logistical problems, accommodation, etc., may not be working to 24 hours. And so it depends on the time. You may have to travel far. And that is why improving access to care, what we have come up as a Ghana Health Service and as health sector, the network of practice, what creates a network of facilities that makes sure that you are able to access care 24/7 within your locality, is addressing this chapter. And I can assure you that the time was longer than now, and I think we can still do better by making sure we create all these services. And of course, Agenda 111 will mean that every district will have a first referral level, and that will also reduce the travel time and access to care. Skill delivery, I'm sure you, Joy, you meant skill delivery, right? That is over 80% now. We've had moved from 40% in the last 20 or so years to 80%. The reasons are that we are very, very difficult that you're going to get 100% skill delivery, because someone will have a precipitated labor before Jack has delivered in the house. So you're not going to get 100%. But those who make it, first, if our information and education has improved, as you can see, antenatal care is high. 98% of our women visit antenatal care, and about 80% plus of them make appropriate use of care. We have seen 63% of women making their first visit in the first trimester, the first 3 months. Many years ago, it used to be only 20%. Everybody was coming the last month just to come and get a card and go and deliver. So behavior towards delivery has changed. And so if you are in a house and you are 10 and 8 of the women are delivering in the hospital, or 6 women are delivering in the hospital, I think you think twice before you decide staying home to deliver. We still have that number, and the use of TBA too has come out. So that is why it's also influencing the outcome. So yes, the access to care, and also we have had a lot more midwives than we used to have. We have one of the highest midwife population ratio in the sub-region, and so that creates access to women who need to have skilled birth attendants. You can deliver with a TBA, but that's not skilled birth. You need to deliver with someone who is trained to be able to offer care for you during delivery. Thank you very much. Sanitary pads. I don't know whether Prof is going to answer that. My answer is that we all want access, improve access to sanitary pads, increase access. As to whether it's tax, or I'm sure there are many ways that we can address that challenge. So I do not really want to talk about whether it's a tax or whatever that is affecting. Thank you very much.
Thank you very much, Professor Kumamaji. for your responses to the questions, and of course to Professor Nim for the presentation. He will now come back to give us our closing remarks and show us the way via the roadmap. Let's welcome him. You're good?
Thank you very much. So those three questions definitely are brilliant questions, and it's already shaping our thoughts on the additional analysis that we have to do when we are doing the analytical report. The question on OT region has been answered in terms of the CHIPS compound. The question on mortality, again, that is where I say a big thank you. In a short while, I'm going to show you the roadmap of the issue-based releases that we are going to do. And number one of that is child and infant mortality, which we are doing next week, which would give us an opportunity to understand the drivers of infant and child mortality. Again, the question on sanitary pads, unfortunately, the DHS does not allow us to directly test whether it is the price effect or not, but we can always do analysis between the wealth status of the households and the type of methodology or approach that is being used for menstrual hygiene. So this can give us a sense of whether the price is indirectly playing a role or otherwise. So thank you for those questions, and as I indicated, it gives us an opportunity to do further analysis going forward. Distinguished ladies and gentlemen, in terms of closing remarks, permit me to start by acknowledging the presence of the Deputy Government Statistician in the presence of Dr. Faustina Frimpong Engwa. Can we see you? So Dr. Faustina Frimpong Engwa directly oversees issues around demography and population issues. So going forward, and as she did with the survey, she's going to walk us through the further analysis that we're doing today. By way of closing remarks, I would specifically want to mention, and Dr. Abuaji did that earlier on, mention the partners that we worked with up to this stage, and going forward, we're going to work with them. In no particular order based on the support that we received. We want to thank the USAID that have been with us throughout this process. Thank you very much. We want to thank the World Health Organization that have also been with us throughout the process, right from the conceptualization stage up until now. Thank you very much, WHO. The Korea International Cooperation Agency that also supported us, the UK Aid, the UNICEF, the Global Fund, and the World Bank, all other development partners that have seen us through up until this stage. We express our deepest appreciation, and we look forward to a deepened engagement going forward. Locally, I want to express singularly our appreciation to the Ghana Health Service, for which today we are seeing the presence of the Director General with us, Dr. Abuaji. Thank you very much, and we look forward to further engaging with you on the dissemination going forward. We earlier on expressed our appreciation to respondents. We want to emphasize that, and we look forward to collaborating with all respondents that we've been engaging in our diverse data collection exercises, especially the ongoing data collection exercises in the area of the Integrated Business Establishment Survey, the Ghana Core Agriculture, and also the Ghana Living Standard Survey, the 8th round that we're yet to roll out. Particularly the respondents for the 2022 Ghana Demographic and Health Survey kindly accept our deepest appreciation. We further want to say a very big thank you to enumerators. The pool of enumerators that we use for this exercise, we cannot contain them within the office. Currently, we're using in excess of 15,000 enumerators for our ongoing surveys, and definitely these are the people that go through the training and diligently give us the data that we need for our analysis. So enumerators, supervisors, and all other field officers kindly accept the appreciation of the service. Then finally, to the government of Ghana, represented by the board of the Ghana Statistical Service, we say a very big thank you for giving us the opportunity to respond to our mandate as the institution mandated to produce and ensure that data stewardship is enhanced in the country. Thank you very much. The second thing that I have to do beyond the closing remark, which I would want, I see that all of you have your packs now. Can I see whether we all have this document, which has in the middle the roadmap? Which has in the middle the roadmap? I see a number of hands down. Can I see my hand if you all have it? Thank you. This is what we leave all of you with today beyond the messages that we've shared with you. We want to walk down the road with you for the next 11 months on what we want to do in the area of health statistics. Ghana Statistical Service is changing the narrative of doing a one-off dissemination exercise and assume that policymakers will take hold of it and work with that. We're going beyond that and ensure that data stewardship is enhanced. So starting from next week, Wednesday, through to the 5th of March, we're going to do a number of targeted dissemination exercises based on issues, as well as doing the dissemination at different geographical areas. We want the media to work with us throughout the process as we really prepare to institutionalize health statistics from April to December 2024. Between April and December 2024, if you look beneath the table that you have, we're going to start with monthly district tables leak based on the district information that I talked about earlier on. So every month, we're going to do a selection of the health statistics that we've shared with you and do a district leak table of all the thematic areas that we shared with you. We're going to focus on some specific products, such as digital products, including heat maps. We're going to have some fact sheets and analytical report to further ensure that the returns of the data that we've collected for the 2022 Ghana Demographic Health Survey is fully harnessed. So we are changing the narrative of seeing Ghana Statistical Service only fronting institutional and regular statistics on economic indicators. Henceforth, we're going to do that for at least 3 or 4 social indicators, starting with health, education, and possibly issues around crime. And this is the roadmap that we've drawn for health statistics using the Ghana 2022 Demographic and Health Survey as the base. I take this opportunity to humbly request all of you to take note of the respective dates and be part of the journey. In today's release, we've not just released a big book out there which contains over 650 pages. In addition to that, we've released a number of products today, which in our minds are very useful if you want to further engage with the data. Number one, if you go on our website today and the website of DHS, you're going to get access to the microdata. Again, as was indicated, we have put out the microdata, obviously anonymized, to allow users to further analyze, interrogate the data in whatever format that you have. Ghana Statistical Service, in addition to putting the microdata out, in the next week would add this data to our Stats Online Bank. So on the Stats Online Bank, you see the census data, you're going to see education statistics there, you're going to see other different data sets there. And as was indicated, this is the only opportunity for us to do triangulated analysis using different data sets to unravel further insights in the challenges that we face as a country. The other products that we've put out there is a summary of the 658-page document. So for those of you who would be negatively influenced with the size of the main report, the summary report comes in handy for us to engage with. Also on the DHS website, we're going to have the START compiler and the API DHS program, which allows us to, again, do cross-country analysis to really assess where Ghana is, such as what Dr. Abuaji indicated, relative to other countries. So we've released a number of products today on the 2022 Ghana Demographic Health Survey for the purposes of enhanced use of data and better policy-informed decision-making. Thank you very much.
Thank you very much, Professor Nim, for the closing remarks and the roadmap. I like the way the professor said it. If you are negatively influenced by the size of the big report, there's a small one for you. Negatively influenced. I'll remember that, Prof. It's influence, but it's, yeah. Awesome. Now we'll be positively influenced by the closing prayer that is coming up right now. Let's welcome Mr. Abdullahi Mohammed from the Ghana Statistical Service to pray for us to end this event, after which we'll take a photo with our dignitaries, and then we will network and have lunch and leave. Mr. Mohammed, Assalamu alaikum. How are you, sir? You're welcome.
We thank the Almighty Allah subhanahu wa ta'ala for granting us to have a successful program. At the time that we are about to start the program, we committed ourselves to Him, and thank God that we've had a successful program. We pray that Almighty Allah will strengthen Ghana Statistical Service together with Ghana Health Service, strengthen us with knowledge, wisdom, and also wealth that will also help us to have more service of such. And we also thank the Almighty for helping us to come out with this wonderful report. We also pray that all the stakeholders should also have access to our report so that they will use it to help Mother Ghana. In this we pray in the Almighty name. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الله لا إله إلا هو الحي القيوم لا تأخذه سنة ولا نوم له ما في السماوات وما في الأرض من ذا الذي يشفع عنده إلا بإذنه يعلم ما بين أيديهم وما خلفهم ولا يحيطون بشيء من علمه إلا بما شاء وسع كرسيه السماوات والأرض ولا يعود حفظهما وهو العلي العظيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
Beautiful voice, wonderful prayer. Thank you very much. Abdullahi Mohammed. We'll take some photos now of our dignitaries. Probably you step. Please drop it over. Dr. Anwar, please join us for the photo as well. Dr. Faustina Anwar, please join us. Thank you. We'll take the photo here. Dr. Larry, Dr. Balsara, Professor Enim, Dr. Kuma Bwaji. Our official photographer, where are you? Yes, please arrange them artistically as you normally do. Atika. So for lunch, UNFPA rep, please join as well. Thank you so much. So, invited guests.